Good afternoon and welcome to our webinar on debunking the myth on vaccination. My name is Esther Rodriguez Chardavoine and I'm the Senior Vice President here at Hostos Community College. I'd like to introduce everyone to the panel, and then our president will give us some opening remarks. So our president, Dr. Daisy Cocos de Felipe, has joined us. Our guest speaker is Dr. Scott Ratzan from the School of Public Health, and he will be the person who will be leading this webinar. Joining us as part of the panel is Joanna Gomez, the Dean of Students, Zach Korenstein, who is our health and safety consultant, Christina Diaz-Zing, who is our HR director, and most of all, our Fabian Wander, who is our health community director. So thank you all. So President, I give you the floor.
Well, I will be very brief. I'm very, very happy that this is also being taped so that it can be shared again and again. Thank you so very much for joining us, for putting this together. We are very grateful to our colleagues from the CUNY School of Public Health, Dr. Scott C. Ratzan, ably representing them and the expertise that they bring to the table all the time, and to see my dear colleagues at the school. I want to add, that just this last few weeks, I have experienced such incredible joy interacting with children, interacting with folks who, are now able to go to summer camp, who are now able to go to the movies, to be in the park, to go out to eat, to go to, even Broadway has opened. And this is all thanks to the good people, the good-hearted people who care about life in New York and vaccinated themselves. And a good number of us have done that. But another good number of us needs to get that done so that life in a healthier New York can proceed with joy and generosity for all of us. I am so very grateful that we are doing this and that we will make this available to different groups as the days go by. Thank you, my dear colleagues, Fabian and Zach and Christine and Joanna and Esther, for this generous gift. And of course, Diana, who facilitates so many things from my office. Thank you.
Yes. Thank you, President. And just before I turn it over to our speaker, I'd like, if you have any questions, to please put them in the Q&A, and then I will ask those questions at the end of the session. So thank you.
Well, thank you, Esther, and thank you, President Coco de Felipe. It's a real pleasure to be here to talk to all of us via Zoom, of course, in our new world on the importance of vaccination and to debunk the myths. So I'm sharing my screen, and for the first 15, well, hopefully 10 minutes or so, I'll go quickly through a number of slides. I'm a public health physician. I've been working in the field of health communication for my career. We have a health communication for social change program at the Graduate School of Public Health and Health Policy on 125th Street. And we've established this activity called CONVINCE, COVID New Vaccine Information, Communication, and Engagement. And this is really built upon years of work that I've been doing and others. And we've been really looking from the beginning on what the consumer, people in New York who are living in the city and others have been thinking about, not only COVID, but of course the vaccination. But as we've been doing that, this is the reality of the world that we live in. We may hear from the CDC and Tony Fauci on the right, but in the reality that we had, especially during the last administration, when fake news became our lexicon, who is deciding what was fake? The media, the independent folks, or the politicians? And we'd like to say we're science and evidence and theory driven. But of course, this is the world we live in. Fortunately, we have been able to come up with vaccines, and I'm going to go a little bit into the promise of vaccines. I've been writing about vaccines and the need for them and how they've helped get us out of of pandemics in the past, notably smallpox is eradicated from the planet, polio is gone from the Western Hemisphere, nearly gone from the planet, and now we have the promise of vaccines for COVID. But while these have been going on for centuries, it's not the vaccines that save lives, it's getting people vaccinated and vaccination. So that's the work that we've been focusing on, not just the supply and the development, which is key, but the demand from the public. So to remind people, the vaccines are not developed overnight. Just like other medicines, they go through a trial period. This time it was a little quicker than usual, but the work for mRNA vaccines and so forth and others predated even when COVID was ever announced. But this is how it starts, a small trial of volunteers, and you basically check for safety. You want to make sure that what you're giving them is safe. Then you make it larger for hundreds of people, and you want to see if it's safe and effective, and then thousands of people in phase 3. And this has been done with all the 3 vaccines that have been approved in the United States, as well as some of the other vaccines in other parts of the world that have been approved. Now, these were approved through the process that we trust with the Food and Drug Administration, otherwise known as the FDA. They oversee the process. And in this case, they had a speedier process that we unfortunately called warp speed because it sounded like it was science fiction, but it really went through a regular process that the FDA was accustomed to, and they approved these for emergency use authorization. But this is how the FDA does it. They only approve it if it's safe and effective, and it's benefit over risk. So we want to have the benefit of the vaccine over the risk of the vaccine, as well as the risk of the disease itself. And these vaccines met all the criteria. They don't just have government employees that look at these. They have peer reviewers, means people in universities throughout the United States, others who are working in the field of pediatricians and family physicians and internists and virologists. And they look at the findings. They speak about these in a public fashion that you might hear these FDA advisory committees or this advisory committee on immunization practices that is convened by the Centers for Disease Control. And then even after these are approved, they monitor and oversee the production of those. And you may have also read that the production facilities for the Johnson & Johnson vaccine that was done at Emergent, which is the contractor in Maryland, didn't meet the safety standards and the production standards. So those vaccines never made it to the market. So the FDA looks at all those parts of the process. And then even after it's approved, they continue to have follow-up with the volunteers after the doses. It's monitored, as I just mentioned, and this idea of side effects or adverse events also are monitored in big ways. But the most critical side effect that most people have is soreness of the arm. These vaccines are injected. These are not like your flu vaccine that you might have got through your nose. So these vaccines, like others that you maybe even had as a child, may recall you get a sore arm, and that's normal and considered mild. Some people do get a short fever, but that also has been monitored in such a way that it has not caused any major problems. And of course, again, the advantage outweighs the risk. For those of you on here, and I'm assuming that hopefully at least half of you have been vaccinated, but hopefully even over the 70%. You've either got one of these 3 vaccines if you live in the United States. The Pfizer-BioNTech, you got the first dose. 21 days later, you got a second dose, and 35 days after the first dose, you are 95% protected. Moderna was a little bit longer, the first dose, and then 42 days protected if you receive the second dose. And then the J&J vaccine, which is only 1 dose, which was 14 days later. Each of these have, again, similar side effects: chills, headache, pain, fever, and so forth. The belief was that some are milder side effects. This is for all ages. What we have found is that some of the younger people have more side effects than older, but these are not anything. Again, the side effects are just linked mostly to your immune response. And none of these vaccines actually inject a live virus into you. So you cannot catch a vaccine cannot catch the disease or COVID from the vaccine. What they all have in common, they all get you to have an immune response. That means your body will recognize if the actual SARS-CoV-2 virus, which is what it's called, gets in your body after you would have been exposed and after you would have had the virus. And this also covers the variants, which you might have read quite a bit about. These vaccines seem to be, at this point, covering all the alpha, beta, gamma, delta variants that may have shown up, at least in the United States and other countries. Again, none will make you sick, and the goal is to get to this community protection, or otherwise called herd immunity. The last few slides just show where we are today. As of Sunday, in New York City, we have 55% of the people getting at least one dose. And as you see, fully vaccinated over half. You may have said, well, we had fireworks. We met the 70% target. That was statewide. We haven't met it in New York. And why we have to be concerned and why we can't just relax everything is this is what New York looks like. 70% are the darker spots. So just because you might live in Manhattan in one of those darker spots doesn't mean that you're necessarily protected. That means everybody there may have the 70%. But as you know, the subway, spans the city and people go back and forth, whether it's for work or for school and so forth. So we really need to move to get as much of New York in dark blue. And that means we need extra efforts to redouble. For those of you who are listening, if you've been vaccinated, tell your family and friends, people in your community. If you haven't, try to get it as soon as possible, and know that this will be the protective nature of what's necessary. So with that, I'm just going to say we continue to look at data. As I said, since the beginning, we've been looking at surveys since March of 2020. We've had a tracking survey. I could go into that, but just to show that we know that people have concerns and we should address those concerns. We now have a New York vaccine literacy campaign with the CUNY School of Public Health and a number of community groups, and we have Convince USA, as I mentioned. Just to show, at least in New York, with our surveys, we found that only 5% of people are really, I will never get vaccinated. Now, it could be up to 9, 10, 11% nationally, but people are concerned about the areas that we've mentioned. They're concerned about safety, and we need to address those. Some people refuse, and some people just don't think that they need the vaccine. I've been exposed, or I'm immune. So we need to deal with all of those. And then the trust issue also is an issue. Who do we trust? This was done before the last election. Since the Biden administration's come in, we have more trust, but we still don't have trust across the board. Many people say, I don't want to get it because I'm vaccine hesitant, but President Biden has said that people are showing up. All the stuff about vaccine hesitancy, more and more people are getting it. He believes, and I mean many people believe, a large percentage would get the vaccine. That's what he said in the New York Post in May, and we have a whole month of action now to get vaccinated. And Tom Frieden, the former health commissioner now and former CDC commissioner or director, said, hesitancy is a better story than controversy. The problem is access, not hesitancy. So we have to remind people that everybody can get the vaccine. It's free, and it's important to get lives back to where it used to be. The other thing is, I don't like calling people hesitant, and this is a study that we did that was published in the New England Journal of Medicine that shows, at this case in May, at this time, 40% of the people were vaccinated. This is national data. But all the blue people used to call hesitant. We said, wait a second, these are not hesitant people. These are people that are ready. The people at the top, avid, these were people that were trying, like many of you probably, couldn't get an appointment. It wasn't in their community yet. Then there were the 24% of receptive people. They wanted to get the vaccine, but they didn't want to go to Yankee Stadium, or they didn't want to go to Javits, or they wanted to get it at their local church or pharmacy. So we needed to work on that. And then there's these neutral people that are just like, hey, I'm fine. I'm just going to wear my mask and do nothing for a while. So our goal has been to get physicians, teachers, nurses, pharmacists, everybody to start to realize that most people are vaccine ready, and we should focus on them. And if we do, we're going to get to the 70, 80% that we need. So that's it. What can be done to build vaccine confidence? Again, I commend Hostos for this town hall. I've done a number of these throughout the CUNY system. I think we need to keep talking about it, showing people that it's the norm to be vaccinated and it's the right thing to do. It's good for yourself, your community, meeting friends, neighbors, family members. And if you are really interested in the academic side, I edit this Journal of Health Communication, as you see at the School of Public Health, and we've got a number of other articles. It's fully online. This particular issue is free and open access. So that's sort of running through where I think sets the stage. And I'm going to turn it back over, Esther, to you and the rest of the great panelists that you've assembled here today. So thank you very much.
Again, thank you, Scott, for that presentation. And I am so happy that we are recording this webinar because we will certainly have it posted and people can look at it at their leisure. But for now, I'd like to turn it over to Zach. He has a couple of questions in the chat box that we can ask you, and that may stimulate some questions from our audience. Zach?
Thank you, SVP, and thank you, Dr. Ratzan, for this presentation. It was great. Talking to many folks within my circle of friends, within the Hostos community that are still hesitant. There's lots of different reasons why, and I think as you addressed, we have to kind of meet people where they are. I'm going to give you just a few, and then, you know, if others have questions, they can kind of chime in. But one I hear a lot is, what's the difference between the emergency use authorization for the FDA and a regular authorization for the vaccine? I've heard many people say, well, I'm not ready to get it because it's a EUA, emergency use authorization. Can you speak to that?
Sure, and thanks for the question, Zach. So, you know, as I mentioned, each of these trials, each of these vaccines went through these trials, and generally speaking, you have a longer period of time to go through an authorization process. So they created an emergency use authorization rather than a full approval process, given the fact that we had a massive pandemic going on in the United States. This has been a process that's been approved in the past. It's not as if all of a sudden we changed and created something in this regard. So my understanding is that the emergency use authorization also has some parts in the regulatory process that speeds up the ability for the federal government to purchase them, to make the reimbursement also at one level so they're all free. So there are other parts that also make it easier and in a speedier way to get to the people who need them. So it's not solely the science side of it, if I can say, that met all of the criteria for a safe and effective vaccine, but also the process to get the vaccine to people. And the first place, as you may recall, we had it prioritized with groups that were an older population that were most at risk, and then first responders and healthcare workers and so forth. So the emergency use authorization gave that opportunity for the dissemination on that level. I would like to say rest assured, and I know that frankly, I don't think we've done the best with our communication when you get, for those of you who did get the patient information leaflet that they call it, after you got vaccinated, and it said, this vaccine has not been approved by the FDA. And like,
Yeah.
well, what are you saying? It hasn't been clear enough. And it's been approved at a level that's met the scientific criteria, but it hasn't met the so-called the usual approval regulatory criteria. So I remind people that this has been, you know, over 300 million doses. It's met the safety and effectiveness. We can see where there have not been outbreaks, where the population is vaccinated, that clearly we're in a better place, as well as the fact that the safety and efficacy, that nobody who has been vaccinated has appeared to be hospitalized to a level that has led to death, which means the vaccines are working as they have been authorized. So that's the basics of the EUA versus the full FDA approval.
Okay, great. And Dr. Ratzan, if I could just ask, as I understand your response, it almost sounds as if the emergency use authorization was also a mechanism to bring down logistical barriers in getting the vaccine to the population. Would you say that that's
I would say yes. I mean, I addressed in the federal level, the Health and Human Services as a National Vaccine Advisory Committee and Subcommittee on Vaccine Confidence. And I spoke to them about this in January, that there's been more of an opportunity to communicate better to help give people the confidence. And for whatever reason, on both the regulatory process and so forth, it does not give the same flexibility that we would like to have. So for example, some vaccines, when they have full approval, you can give them a name, you give them a trade name like Gardasil or Shingrix that you might have heard of for the former for HPV, prevention of human papillomavirus and cervical cancer. The second one, Shingrix, for shingles for people over 50. those have names after they've been approved, and they get marketed more by companies and so forth. Because we have the regulatory process that was sped up in this kind of pieces, there's not as much, flexibility on some of the communication and engagement that we may have expected. But I do think, and I do know that approval is not too far away from what I've heard. That's still going through the same data sets that gave it the emergency use authorization, and now even more data from the millions of doses that are out there. And while those millions of doses are out there, there have been some, shall we say, unfortunate that they've been adverse events that we've heard about Johnson & Johnson's vaccine that created a pause that made it more at risk for younger women. We also have heard about some of these other issues that may be there for myocarditis or pericarditis on the other vaccines, but the numbers are so small that these risks that we're finding, even with the emergency use authorization level that we are, and the risk of getting the same or worse from COVID, are much, much lower with the vaccine. So everybody should rest assured that the vaccines will protect against the worst parts of COVID, which could lead to death, even in young people. There have been young people in the United States that have died from COVID, and we shouldn't think that they're immune. Like we may have heard early on, don't worry about kids because they didn't seem to be getting it at that point. But everybody is at risk, especially as these variants are beginning to make their way throughout the country.
Thank you, Dr. Ratzan. I could keep going, or I could.
Yeah, so far, Zach, we do not have any questions in the Q&A, but I do want to ask Scott a question. When the vaccinations first rolled out, and then in terms of the ages, when went first, of course, the senior citizens and all that, and all these vaccination sites were popping up. And now we're seeing that a lot of the sites are closing. And so is that giving false hope to people who have not been vaccinated that everything is okay? Because that, especially here in the Bronx, when you look at the data of the number of people that have truly been vaccinated in the Bronx, we are a very low percentage.
Yeah.
It's a very dense population.
Well, unfortunately, there are structural inequities that have continued to plague, we can say the Bronx and other parts, unfortunately, in terms of just health access and engagement. What we found with some of our surveys that we've been working, we have a Harlem Health Initiative and others that have given us the opportunity to do some more surveys to really try to understand. We find that the Black population is more interested in going to where they're, at least this is the Harlem as well as other parts of the city, we found, are more interested in going to their doctor or their health clinic. So most of them, or many people, don't have a physician or a clinic to go to. So then we have to find what's next in mind. But we did find that the Black American population was much more, in New York City, was much more interested. When the Hispanic, Latino, Latina, where we put them all together, they were more interested in doing more community. So it could be at a pharmacy, or if there was a community site. But we also found that a lot of people didn't like these mass sites no matter what. They didn't want it in a church that wasn't theirs, or they didn't want to wait online at the stadium or go across town because they were worried about the subway or the bus, or couldn't get half a day off of work, or worried about the side effects if they missed the next day of work. So it's been complex, and we haven't had enough of that understood, that instead what the city and the state and others have done really across the country, that let's just do a mass site, and if people don't show up, then we've done our job. No, we need to do better, and we're trying to do better. We've been working with the city. There's a whole cross borough, I don't know what to call it, a task force, but there's a vaccine equity group, and there's some others. We're trying to give some ideas, but no, because they're closing, it's not over. Today's New York Times has a survey that they cite, even in a place like Tennessee. They asked 51% of the people said they think it's largely over because it's not in the press as much. So we really need to warn and show people, and that colored map of the city should worry us all. When we do a lot of these town halls, people are worried, not because where they live is dark blue, but because they know they've got to get on transportation, and people live more than 3 blocks away from where they work.
Mhm. Thank you. I, Fabian, you had your hand up to ask a question?
Yes, thank you, Dr. Ratzan. I appreciate your presentation today. And so the question is, we're at a college, higher ed, majority of students at these community colleges range 18 to 24 years old. Obviously, there's younger and some older. But I see that the many of those folks in that age range are ambivalent about getting the vaccine. And I believe Professor Hoyland also kind of mentioned that in the chat, that the percentages of students in that age range are more ambivalent. They're unsure if they want to get the vaccine, and really how to better engage those students seems to be effective to have these direct conversations with the students about their concerns as a class or individually. But I'm not seeing so much of this targeted kind of marketing and outreach towards that population. And is that something that we're seeing that it's going to increase in the near future, or is there, is there any plans to kind of address that specific age group? Because it seems like the age group that are less likely to want to get the vaccine.
Sure. Well, unfortunately, they're less likely. The numbers are lower because it hasn't been available to as many since the beginning. Now, over 500 colleges and universities, and CUNY being one of them, is requiring the vaccine to enroll for in-person classes in the fall. Again, today's New York Times has a strong support in the op-ed page on the use of mandates and requirements. That's the only way. The author today writes, if we don't remember, we got out of smallpox. Even was a Revolutionary War, it was necessary. And then polio had mandates as well. So the federal government does have the wherewithal to suggest it, although it's not a federal policy. So states and cities have been doing it. So I'm strongly supportive of those efforts where the states and cities, in CUNY's case, of course. Now, that doesn't mean that just by mandating everybody's going to be online straight away. It's not so easy like registering, right? You need, even if the single dose one, you need 2 weeks to have the efficacy for the coverage. So I suggest that we do that. We are working with our project, and we could tie in both your students, faculty, staff, everybody who's thinking about it, of ways to do it. I do know that we've been trying to package some, I'm not even going to call them courses, these kind of, town halls discussion. It'd be great to have sort of, if I could call this an ambassador group of not people of my age, but of your own students who can talk to others, because I really think they do need to listen. I very often get, women of reproductive age, yes, you should be vaccinated. It will not sterilize you. It doesn't cause issues. But that doesn't mean it's still, they need to know more. Now, if I have a choice, can I choose one vaccine over the other? If I am pregnant at that time, yes, you should discuss it with either your community health center people you're working with, or your physician if you have. So all of these elements are really important. I do believe that this population is key, and the university age, while it's not university enrolled is the age you're talking about, there's still others that are not in the university, that system, that we need to get to as well. So there's also social media opportunities, and that's probably a strong place for them. And we're working to also identify, we call ordinary people doing extraordinary acts for vaccination. They're not health workers that are doing their job or doing more than their job, but regular people that are helping someone in their community enroll because it's so difficult to navigate on the internet or get an appointment, or they're actually doing some physical ability to get somebody to a site, or as we're going to have more home visits, alerting them to, yes, you can still get a vaccine if you enroll for a home visit. So I think all of those things hopefully will be in place. We're also trying to work with the city to help on their efforts. And I think, any of you as part of the CUNY system, it would be great to, figure out a way that we can all do this together.
Oh, thank you. So I have two questions on the chat. So one is from our Professor Page, who really is inquiring about taking supplements such as vitamin D3, niacin, NAC, zinc, vitamin C, melatonin, exercising, getting 8 hours of sleep, and eating more healthy food, and adding garlic and onions to your meal preparation.
Wow. Okay. That's a lot of stuff. I do a number of those. I've been doing many of those before COVID for sure. So, melatonin is something that doesn't fit the same piece as others because that is generally related to sleep in people with sleep disorders, or it's a little bit more complex than many of the others. And I certainly want to make it clear that we don't take melatonin in the morning. Certain of those there's a big huge range of safety, so you really can't take too much vitamin C or exercise too much if you're a certain level, usually your body. So yes, you should have the 30 minutes of exercise, 7 days a week if you can, but lower. All of those have some recommended doses. There has been studies on vitamin D, on niacin, also links with cholesterol. I mean, these are other supplements that are not a bad thing to take, but they do not relate to COVID. And I wouldn't want to be giving any prescribing advice to any of those. The only one I would say is yes, 6 to 8 hours of sleep is recommended. The melatonin is one not to take across the board, and I don't think the others would be harmful if you also even follow the recommended daily allowance that also has been through the FDA in terms of approval for many of those supplements.
And our next question is from Eric, who happens to be our government relations person. And his question is 70% is 70% a citywide goal? That doesn't seem like enough for herd immunity, but even 70% will be hard to get to, let alone more than that.
Absolutely. I mean, Eric's raising a great question. I was pressed on this with a media interview yesterday because we've been locking into the 70%. I still believe we need to aim for the 80 or 90%. And even if you do a little bit of the math, remember, these are not 100% effective or efficacious. So even if we had 80% of the population and we had a mix of the J&J and the other two vaccines, that would only put us in the 70% of coverage. So I do think we need to aim higher. And certainly, we did say for the CUNY students who are going to enroll, only 80% need to. Where everybody, even if you have been positive for COVID, whether you're asymptomatic or symptomatic, you still need to get vaccinated. And we need to aim for that high percentage. The 70% is citywide right now, but I do believe, and I think the city will put higher numbers on there, as many people in the epidemiology field believe that we need to aim higher for really herd immunity.
We have one question from Pearl Schatz, who is an employee here. So the question is, as a public health communication expert, what three or five things do you think a college should focus on for our campus communication, both a one-to-one and college-wide?
Sure.
He happens to be doing the communications for the COVID-19 for us.
Sure. So a lot of my work has been on health literacy. So health literacy is giving people the knowledge and skills to make appropriate health decisions for the people side of it, can we say. But then we also have the system side of how do we make it simple, where the system is set up in a way to make the appropriate health decisions, make it easier, as the person asked before, for people to exercise. Or it's clear we have a smoke-free workplace, right? And smoke-free schools. That's a good thing. At the beginning of the Obama administration, we didn't have smoke-free in the federal government. So these things, they take time, but now it's normal, right? The city was more smoke-free and tax cigarettes higher than others. So we're the leader in many of these areas. So I think what we need to do is first help create an environment that health is important and give people the knowledge and skills, shall we say, for the health literacy that I mentioned. Now, since we have COVID, we need to warn people and remind people that COVID is real and it is a pandemic and it's circulating right now, and it's not going to go away by doing nothing, right? So we still have to have masks and be vigilant in inside places before we have the level of vaccines that are the 80% plus that we've talked about. And then we also see fewer hospitalizations and fewer new cases. So we know that the vaccine is not circulating as much in society, particularly in New York that we're aiming for. So one, basic health literacy, remind people. Two, understanding the risk of getting COVID. And then three, which is most important if people haven't, is to support vaccination. So we have that same sort of coverage. And those are probably the top three. Now, I really think the fourth one will be, how do we build and sustain it? So I'm expecting that we will all need to get a seasonal flu shot in the fall. This has been recommended by the federal government. Just the Advisory Committee on Immunization Practices last week said that they would support it also with COVID or with a booster if it would be necessary. The federal government has set a target by 2030, but every year we should get 70% of the people with a seasonal flu vaccine. And we know that we haven't been there. So it used to be people over 60, then over 50. Now we're recommending for everyone, just as another opportunity to think of what CUNY could do. In Massachusetts last year, every student at every university, public or private, that enrolled had to have a flu shot. So we know that it's important. So that's probably something would be the next thing to take. And then just because we have a lot of young women and others who are reproductive age, we know that HPV can prevent cervical cancer. There's HPV vaccine can prevent it. So we should do everything we can to get that coverage up as well. It's a shame to see also the disparities amongst this country in that. So, those are kind of my basic pieces. I'm, a public health guy, so I really want to get say communications expert. Thanks for asking that, Pearl, that these are the pieces that we need to do. We need to try to do it for everybody. We need to do equity. It's a sort of social justice that should be clear. And we've actually called vaccine literacy as one of our goals, but the broader piece, I think the question is health literacy.
Yeah, and I couldn't agree with you more. I just want to ask you one question, and then I think Zach has maybe a couple of more to ask while we wait for our audience to submit more questions. So I've been hearing that both Pfizer and Moderna will, people who've gotten that shot are safe from having contracting any of the new variants that are appearing across the country and as well across the world. Is that correct? I mean, is there data on that?
Well, the data thus far shows that the variants up through Delta, and now, they're even calling a Delta plus variant. They
Right,
found
Delta
200 of these
plus.
different places. It's not like you can do this overnight to just take this variant and do a test against a vaccinated person, or you need more than one person for this. So it appears, and the data do support right now, that these are protective against all of the variants that have appeared thus far. But let me say here, whether we call them Delta plus or we go to the next letter, we're up to Epsilon or Gamma or whatever we're going to keep having here, there will be more variants. I mean, that is clear. And they could be variants of this, and there will be more viruses that show up in the future, hopefully that are not as deadly. But we've known that we've seen this happen, so we need to be prepared for it, and they'll keep monitoring. And the idea behind a booster, just like the flu shot that we'll take this fall, it's a predictive flu shot. So we look at, right now it's winter in Australia, we say, well, what kind of flu is there? And we know with travel, that's usually the same sort of flu virus that comes to North America. That's the vaccine that we make. So we're trying to stay ahead of, okay, if there's a variant or variant plus or variant plus plus, whatever we end up calling it, because these are arbitrary names, that we can make the vaccine address those. And I think that will happen. There's enough sharing of a virus and the strains and diagnostics now that we can do that quickly. But we need to stay on top of it. And the sooner we get people vaccinated in this country, the fewer variants that will show up as well.
So while we were speaking, I have some questions in the Q&A, and one of it is from an anonymous attendee. Should survivors of the severe COVID, in quotes, and or long haulers, as well as health compromised individuals, get vaccinated, knowing that the vaccine is not a therapeutic, which might invert the cost/benefits analysis?
Well, I mean, it's a complex question with a lot of variables, just even putting, the people who have recovered from COVID, people who have long COVID who still have symptoms, and immunocompromised. Those are even different groups. And I would say you need to, on a case by case basis of where one might be in that. So I don't want to answer that across the board. But what I would answer is that vaccination should be considered. These are preventive vaccines, so they prevent the disease. There are therapeutic vaccines, which is what I think the anonymous person was referring to, that could boost your immune system. That some vaccines that you do give after you've been exposed, like if you have a rabies, if you get exposed to rabies, right away you should go to a doc and you can get a vaccine and still prevent you from getting rabies. If that were the case. So this vaccine is not thought of that way. It's not like, oh, I test positive from COVID, boom, I get a vaccine. This is a preventive vaccine. So that's the way that we should be looking at it. Most of the evidence thus far has been suggesting that people who have been exposed or tested positive, getting the vaccine gives them an extra layer of protection, because you may have been exposed to the pre-variant virus, let's say, and your natural response has been to not make COVID bad enough that you would go in the hospital or die. So you've survived it. So you have some immune, an immune response, whether antibodies or other helper cells or other cells that you have in your body that would attack if you would be exposed to that again. But the variant might come in and your natural infection didn't protect as much as a vaccine would have that gave you the initial virus, the alpha, beta, gamma, delta vaccine variants that have shown up. So that's the fundamental thinking behind it, why we need to have the vaccine, even if you've been exposed. The long COVID is a different situation. And for better or worse, we're all living in New York City, right? And this is the epicenter. We've had more cases than any other part in the country. So there are some of the best medical clinics and physicians that are following this. And if somebody has that who's listening or knows of somebody, I would suggest they have that discussion with the docs that are looking at the real-time evidence. People like me are looking at evidence after it's been published and peer-reviewed and so forth, and listening to anecdotes. So we are monitoring, but different levels of evidence to make some of these decisions.
Let me just ask one question from Diana. So the WHO recently shared that the continued use of face masks are recommended, whereas the CDC says it's permissible to remove masks indoor. Which guidance should we follow? And as you know, the mayor just sent something out about not having to wear a mask if you're vaccinated. Compared to other CUNY schools, ours is located in the South Bronx, where there is a disproportionate rate of vaccinations. Can you talk more about why this may be?
Well, sure. Well, personally speaking, see the mask behind me, that's been there for a while, and there's even two masks, but I'm not double masking. But if I go into a closed indoor environment, I'm taking an extra precaution. I'm double vaccinated, that I would wear a mask, and it's an individual choice. And if I could say, luckily and thankfully, in New York, and at least in parts of this country, that's looked at as a positive symbol. You're taking care of yourself and others. And it doesn't mean I'm not vaccinated, that where you so-called have to wear a mask if you're not vaccinated for the honor system. So as a public health physician, communicator, and so forth, I would say that a mask is a good thing to do if you're indoors for a longer period of time or with people that you may not know. Now, that doesn't mean we should necessarily require it across the board. The WHO, the World Health Organization, has looked at the data, and they try to make global proclamations, and we don't have the same coverage everywhere. But I don't think it is asking a lot to wear a mask as a precautionary measure. I would say, though, outdoors, the mask is not really necessary, at least if you are vaccinated. But that doesn't mean it doesn't, it may protect you against other viruses or pollution or so forth. So maybe there's some other secondary things that are out there, but for the most part, masks are good indoors. I can't really say that we should make these required. I've spoken to a number of different groups that they're giving people the opportunity, if they're not vaccinated but tested negative, and get the Excelsior pass for those couple of days, where they should still wear a mask if they're not sure if they're positive or negative, because it's a good thing to do as a citizen and as a part of a community. But I'm not, unfortunately, able to make the proclamation that, you know, masks are mandatory. And just like we're hopefully able, I think as somebody said before, to get to the 80%, hopefully we'll be there. And when we have this discussion in the future, you know, masks will be, you know, part of our past.
Okay, we have two more questions that I think, I mean, because you've responded to how the EU process worked. So there's two questions. Is there any discussion / plan to categorize PASC individuals as temporary disabled or partially disabled?
But I frankly, that's beyond my scope. I'm not that's both perhaps a legal issue, a human resource issue. I don't know if those are done local or not. The PASC has to be certain criteria that need to be certified, but whether by clinical measures or clinical expertise. And I don't know, you know, frankly, those kind of criteria that are necessary to make that call.
And I know that Christine Diaz had her hand up. You're
I mean,
Thank you, SVP, and thank you, Dr. Ratzan, for joining us today. Question, has the School of Public Health developed any materials, flyers, brochures that's shared with the other CUNY colleges in terms of promoting vaccination, especially if we were to use ambassadors to you know, to communicate or to disseminate information?
yeah, we have a group of students that are working on a variety of projects, some of which have the sort of vaccine literacy, and at least in English and Spanish, some printed materials. We will have some of these videos that will go live tomorrow on bigshotheroes.org. But we haven't been working solely on the educational materials. I mean, I've done a number of different seminars, and we do have a team that's put a lot of different pieces together. We'd be happy to work with you, and I could put you in touch with in fact, Hannah Latham and Lauren Rao, I often invite to all of these to answer. There are two program leaders working on our Convince USA projects. We also have this New York vaccine literacy campaign, which includes the city and 6 other counties in New York on a community effort that's just started. So that will have some materials, and we'd be happy to invite all of you and others to engage. And we've got a number of great students, and whether some are early in their careers, some are medical doctors in the faith community, others working with us while they're getting their degree, and others actually been working in the Department of Health and Mental Hygiene and so forth. So we've got lots of ways to link in. That should not be a barrier. And you know, if we're asked or able to help identify those, we can give some generic ones, but we also could work with you for some tailored ones.
Thank you.
And I have one more question for you, and that is, what resources or advice do you have for educators to provide information and open discussions about vaccine? It seems students are getting most of their information from viral social media posts that depict the dangers of the vaccine. I use the WHO simulation on social media filters to generate a discussion on information literacy, but it seems like trusted messengers, i.e. Latino medical professions, would be more effective in small groups or classrooms. Any thoughts?
Well, I think that's great. I mean, we've tried to do many of these community discussions thus far, and bring in the providers. One of our health communication students is a pediatrician in the Bronx. She just did one last Friday, I think, with the American Academy of Pediatrics and other groups. So we would welcome that opportunity. I know federally, the Kaiser Family Foundation has also done something with the health secretary, who's Latino from California, more on domestic national pieces. But we would like to be able to do and engage in many of those. I know that there's a vaccine confidence group in the mayor's office, or at least in the Department of Health. And our new New York Vaccine Literacy campaign can help link up with that as well. So please, whoever has that, I'll put you in touch. We also have, we've rated that basically via students on ease of use, accuracy. They've already met external standards of pieces for information campaigns. And there's lots of things that are going on. The student or whoever just asked the question of young people and social media. I know tomorrow there's some hashtag for a pause, or Share Verified, which is a United Nations group, is trying to get the world to say, okay, that's pause because we have so much misinformation about vaccines and about COVID in general. We're working with a lot of different groups, but we're frankly, the science and the data folks are up against a steep hurdle or steep hill, as the anti-vaxxers have a large share of voice on social media. So I would commend anybody who's trying to work on those efforts. There's another group called First Draft who's been looking at this when it's been wrong in the media. They're also with the CUNY and the School of Journalism. There's a couple of other groups that are looking at this. We've tried to focus, but we're trying to focus on those vaccine ready people and people that are on this call to help them make the right decision for themselves. And the requirement is the school and university and others try to help them make the right decision that's good for everyone. So that's the hope that we could lead in that direction. And again, I'll put in touch with some of our people that if people are interested, and it's not limited just to School of Public Health students or graduates. We're all in this together, and would really like to figure out a way, especially with Hostos and the important location in the Bronx and the people that are going through on your campus or online.
Thank you for that. So we have one question also from another faculty member. Can you speak a little bit about the data coming out about the durability of the immune response and how that interfaces with the variant issue?
Sure. The data that continuously be reported on durability, meaning the length of time after you've got the second dose that will last. And if you noticed on the slides, it was 14 days after you would get to 95 or 97% if you had the one of the mRNA vaccines, which is the Moderna or the Pfizer. The J&J one, which is the single dose, well, has 14 days afterwards, seems to be a lower percentage. The numbers that keep coming out and are reported in the press are that the durability seems to be quite good for the mRNA vaccines, even though you have had the CEO say a booster will be likely at some point. He's not the scientist, but the science is starting to be very positive that they're going to last and they'll be durable for some time. So if you get those, you can feel good about it. They are saying, though, that the J&J vaccine and others, if you've got that, it doesn't mean you should feel bad. You may have less durability and may need a booster. But right now, because the US, only about 5% of the 350 million doses, only 12 million or so have been the J&J vaccine. So most of us are in the Moderna and Pfizer area, and that durability looks good. I think there will be other recommendations if one who's listening here or knows of someone who has the J&J vaccine that might help its durability, but that would be conjecture on my part, but that's how it's been reported at this point.
So right now we have about 5 minutes. I want to ask Zach if he has any pressing questions that he would like to ask. And then I'd like to give you an opportunity to give us further insights, things that we should know. And clearly, I'd love to follow up with some of the suggestions that you have made so that we can use that for our communication, for our social media, on students, because we welcome all the help we can in trying to get our students to get vaccinated and our staff and faculty. Zach, do you have any?
No, I mean, really, all of my core questions have been kind of asked and addressed, and I'd prefer to turn it right back over to Dr. Ratzan if he had any final words for us.
And panel, you don't have any questions for him? Okay. So then I give you 5 minutes to do your closing remarks.
Well, great. Well, I don't really have any slides per se to closing. We can certainly say that, our hope is to actually build vaccine confidence and a vaccine literate society. And that, of course, begins with a place where we can teach people
Mhm.
in a community environment, as well as have rising tides for everyone on the health. And we've been working with health communication for social change, that we know that this is the acute phase, but we're moving to a recovery phase. But then there are structural inequities. There are big social issues. There are other parts that we need to remind. That's why the question earlier about, do we just need to have mass clinics for vaccination? Well, if we do that, yes, we're getting people vaccinated, but it'd be better to have people get their annual exam or preventive tests, whether it's a flu shot or cancer screening or other screenings, and get their vaccines. So we would like to build in ways of having that kind of connectivity that's there, whether they're community health centers, whether with community health workers, workforce, working with whether they're pharmacy chains or those that have anything related to the health area, that health is not just in a hospital or facility. So with that, we've been working, as I just put, for at least panelists on the big shot heroes. You can do a search with Convince USA at CUNY, you'll find us. But Esther and your whole team and President Coco de Filippis are happy to give our names and our linkage. We have a number of, again, students working on projects, and these are real applied field work that we'd be really happy to work with any of you on doing the best we can for your community, the reach of your community, and the value that we could add to society. And with that, I know that our dean, Ayman Al-Mohandes, and others is very supportive of all these efforts too, if interested, do it at that level.
Yeah, we clearly are interested. I mean, again, you stated, where we're located, that, our students, and just the data that it shows that, many are not getting their vaccinations. So we want to change that. We want to change that dynamic, and so that people can come on campus and really enjoy being a college student.
I just want to say that this has been so absolutely generous. And the fact is that we will not stay too far from you all in terms of requesting additional guidance and support. I'm certainly going to write a thank you note as well to Eamon and others for this. Dr. Ratzan, how wonderful. And this was very, very, very comprehensive. And I think the questions will help us address some of to clarify some of the challenges still before us. But the college is, as you say, generous. It has been for more than 50 years, this absolutely bridge to wonderful quality education with hope and care and understanding of the absolute difficulties that our students face. They are our heroes in that they continue to persevere under circumstances that this pandemic has actually brought even more so to the surface. So the folks that you see here have worked so diligently to support our students and to support life so that we continue. But this is a very practical conversation as well. And I think it will give us some of how should I say this, the scientific information that may be communicated again and again to continue to encourage vaccinations among ourselves and our students and our communities. So, mil gracias, as we say, mil gracias y bendiciones. Many blessings. Thank you.
Thank you.
Thank you, President, and I'm thanking the audience for taking the time to join us in this webinar. As I stated earlier in the session, this is being recorded and it will be available. And again, thank you so much, Dr. Ranson. We look forward to seeing you again, hopefully maybe in person at Hostos Community College, where we maybe have you talk to our students directly. So thank you again.
Thank you.
Thank you, panels.
Thank you. Good luck, everyone. Stay well.